Now, quite a serious health story. I mean, amid the growing threat of Mpox, formerly known as monkeypox, the Southern African Development Community SADC 44th Summit held in Zimbabwe this Saturday has urged member states to strengthen disease surveillance, diagnosis, testing and clinical care, infection prevention and control, as well as awareness raising of the disease at all levels of the community.
So the summit also directed the bloc's secretariat to convene an urgent meeting of health ministers to address the impact of the disease, to facilitate a coordinated regional response to combat spread of the disease. The World Health Organization, WHO, last week declared a public health emergency of international concern, whilst the Africa Centers for Disease Control and Prevention, Africa CDC, declared the disease as a public health emergency of continental security.
So one must wonder, what is Mpox indeed? You know, it is, according to the World Health Organization, Mpox is monkeypox, is an infectious disease caused by the monkeypox virus. Now, it can cause a painful rash, enlarged lymph nodes, as well as fever. Most people fully recover, but some get very sick. And anyone we know can get Mpox. It spreads from contact with infected persons through touch, kissing, or sexual intercourse. So,
interesting. This look, guys. As soon as you see the symptoms, of course, you know what you're going to do. Go straight to your doctor because it's really critical. But I know the Zimbabwe Ministry of Health and Childcare is putting in place, or has already put in place, programs. And I tell you now. And I say this without any shadow of a doubt because I've done the reporting on it. Now, our Ministry of Health and Childcare, when you look at how they dealt with the cholera coming in, how they dealt with all the other COVID, for example, I really, you know, they're good at this stuff. I mean, we don't want them to do it. Of course, we don't want Mpox to be here, but they are good at prevention and obviously communication, particularly going out. But look, how do you get this? Well, you can actually get it, and this is something that happens in the rural areas as well. I know my relatives, we used to go hunting for rabbits and animals and so forth. You can get it that when you're cooking them, you're skinning them. You can get it when skinning, and also contaminated sheets, clothes, or needles. I mean, think of Mpox as a contagious disease, a bit like flu, if I can put it that way. If you cough or sneeze, you can catch it. But in this case, it can also come from animals, from hides, from needles, from sheets. It's quite serious. So this is why the SADC leaders have flagged it as an issue to look at.
Absolutely, and pregnant women may pass it, you know, to their unborn babies. So we need to be very careful and be on alert as far as that is concerned.
Konapo ipapo ba ZTN Prime, DSTV channel 294, the place to be.